When the diagnosis is given, the prudent thing to do is to take a step back, take a deep breath, and to tell yourself it's not the end of the world. Relationships may change, but sometimes they can change for the better. Take time to take care of the important things, the financial, the legal paperwork, healthcare proxies. Those things should be addressed sooner rather than later. But Alzheimer's, because it's a progressive disease, gives you time to really figure out how to make the most of the time you and your loved one have together. There was a great story from one of the caregivers I spoke with whose wife was diagnosed with early onset Alzheimer's. And one of the things they did was to make sure that they did a lot of worldwide travel. They had a number of countries they wanted to visit on their bucket list. And once she was given her diagnosis with their physicians okay, they were able to spend a couple of years traveling around the world while they were still able to enjoy this quality time together. So I think what needs to be done is to really sit down and prioritize what's important to you, what's important to your loved one, and to take it day by day. If you look at Alzheimer's and you think 2, 3, 4 years out, it's scary, it's overwhelming. It's more important to think about today or tomorrow or next week or perhaps next month. What can be accomplished, what can't be accomplished, and not to get into this overwhelming rut where inertia sets in and nothing gets accomplished. It's also important, I think, to ask questions, and if you're not getting the answers you need, keep asking. If the clinician doesn't refer you to a support group, ask for a referral. Get into a support group that deals with other people that have been newly diagnosed. Sometimes the best way to learn is from others that have been there, and they can give you the tips, they can give you the advice, and they can also let you know you're not alone. There are other people that have been through what you're going through, whether it's the patient side or the caregiver side, and that there's a whole world out there that is still yours for the taking.